Hello everyone, welcome to HIM 225. In this lecture we are covering chapter 24 in your textbook. Please turn to page 590. As always, I want to encourage you to look at the abbreviations and acronyms that are in the beginning of the chapter, and of course the glossary terms that are at the end of the chapter. And those are on pages 620 and 621. Actually, 621. I encourage you to go ahead and look at the chapter review exercises that you have for homework before you start reading the chapter and listening to the lectures. One of the things that I want to point out to you is that in this chapter, we're covering codes from chapter 19, which is the injuries and poisonings chapter. And then we are also covering guidelines from chapter 20, which is external causes. Now, if you think about this, it makes sense because chapter 19 typically is dealing with injuries, and those injuries and poisonings typically have an external cause. So they have incorporated those guidelines. In chapter 25, we continue studying from chapter 19 and 20. And in chapter 25, we're going over burns, adverse effects, and poisonings, and then those associated codes in chapter 20 for the external causes. Now, on page 591, one of the things that in the guidelines, it tells you that most of the categories in chapter 19 have a 7th character requirement. The exception to that is fractures. And that 7th character is either an A for initial encounter, a D for subsequent encounter, or an S for sequela. And keeping in mind that a sequela is a late effect, and so we do cover those late effect guidelines as well. And you can see in this first category, we have this 7th character. And so all of the codes here you see are red because they do need that 7th character. And in many cases, the 6th character is going to be an X, which is the placeholder before you add that 7th character. Now, it tells us that a patient can be seen by a new or a different provider over the course of treatment, and that the assignment of that 7th character is based on whether the patient is undergoing active treatment and not whether the provider is seeing the patient for the first time. So you can't assume that initial encounter means the first time they go to the provider, and after that everything is subsequent. That's not the case. Initial encounter implies that the patient is still receiving active treatment for that particular condition. The guidelines go on to tell you that if it's a complication code, active treatment refers to treatment for the description described by that code, even though it may be related to an earlier precipitating problem. And it goes on to talk about a code for infection and treatment. And then even though this code relates to the prosthetic device that was implanted in a previous encounter. So 7th character A is used for each encounter where the patient's receiving active treatment. D is used for encounters after the patient has completed active treatment of the condition and is receiving routine care for the condition during the healing or recovery phase. The aftercare Z codes should not be used for aftercare for conditions such as injuries or poisonings if the 7th character is provided for subsequent care. For example, aftercare of an injury assigned to the acute injury code with the 7th character D subsequent encounter. So we're not using Z codes for subsequent encounters when in fact there's a D code. The 7th character of S is for sequela, and this is used for complications or conditions that arise that is a direct result of a condition, such as a scar formation after a burn. The scars are a sequela of the burn. So when using the 7th character S, you need to use both the injury code that precipitated the sequela and the code for the sequela itself. The S is added only to the injury code, not the sequela code. The 7th character of S tells us that the injury tells us what the injury was that was responsible for the sequela, and then that specific type of sequela is sequenced first, followed by the injury code. So let's look at some examples. If we look at this first example on page 591, injury of the left wrist and dislocation of the right elbow from a fall on an escalator in a public hall. The dislocation was reduced. So to code this dislocated elbow, in the index we're going to go to dislocation, elbow, and of course this was not congenital, it was not recurrent, this was traumatic. We really don't have any more specific information, so we are going to be choosing the default code for this, and it was the right elbow. And if we look through these codes, we can see unspecified like dislocation of right ulnohumeral joint. And we know that we need to have a 7th character with this. And when we look at these, we're going to choose A because this is the initial encounter for this particular injury. We also have an injury of the wrist. And in the index, we can go to injury, wrist, and then we will be choosing the default code as none of these subterms are applicable. So we'll go to S69.9. And in this category, we are going to be choosing S69.92 because this was the left wrist. And so again, we need to have a 7th character to show that it was the initial encounter. So we're going to choose X as our placeholder and A for initial encounter. Now we have some external cause codes. To find external cause codes, we are going to choose the tab for external cause. And this will take us, this is the index for external causes. If we look at chapter 20, we find that we have a nice little note here, which we are going to go and look at this in a minute. You can see this, there are not many sections here. There are sections related to accidents, intentional self-harm, assault, an event of undetermined intent. And then, of course, we have legal interventions, operations of war, military, terrorism, complications, and then supplemental factors. In this index, it can be challenging to find these codes. And I'm going to go to fall. That's the most obvious thing. And this patient fell on an escalator in a public hall. And you'll notice right off the bat under fall, we have down and then escalator, W10-0. And this was an initial encounter, so we will use the number of X's that we need as placeholders. So we have 2 X's in the 5th and 6th position. And then again, we use the initial encounter 7th character to reflect that this was the initial encounter. So W10.0XX. Then the next code that we actually have is a place of occurrence. Now, I want to show you that for place of occurrence, literally in the index, you go to place of occurrence. This was a public call, so we'll go to place of occurrence, and then public, and then hall, Y92.29. And that is a complete code for us. The other thing that we have done here, coded, is the reduction of the dislocation. So in the index, if we put in reduction for dislocation, it tells us to see the root operation repositioning. Now remember, when we're going to this root operation, we are doing a repositioning of the joint, not just the elbow, but the joint. So we can go to joint, elbow, and then this was the right elbow. And so we can see that it takes us to table ORSL. This is external. Our root operation is external, and there is no device, and there is no qualifier. In the next example, this patient is being seen in follow-up for a healing blowout fracture. So this is an example of where we are going to apply the code for the acute injury, but we are going to use the 7th character of D to reflect that it is not an initial encounter. That means there is no active treatment. This is a subsequent encounter, so we know that this patient is being followed after the acute injury has been treated. Now, when we are coding fractures, we have to be specific that our fracture is traumatic. It is not a pathological fracture, it is traumatic. So when we go to fracture, traumatic, and then blowout, we will find the code S02.3. And of course, there's a dash, so we know we have to complete this coding in the tabular. So S02.3, click on that code, and we know that this is a subsequent encounter. So we are going to apply X for our placeholder and then assign the 7th character of D for subsequent. And then, of course, we have an external cause code. So in the external cause code, we go to fracture, and we see this code in category X58. And then again, we use the same 7th character of subsequent. So we fill these 4th, 5th, and 6th characters with X's as placeholders and then apply the D. In the next example, our patient has a keloid scar, and they have this keloid scar on their left wrist, and it is from a previous burn from an accidental fire. So this is an example of a sequela or a late effect. And keloids forming from scars are not unusual. Sometimes patients develop keloids from having piercings done. In the index, remember that the guidelines tell us that we're actually going to code the sequela first. The sequela is the keloid scar. The accident was the burn that is responsible for the specific sequela. So L91.0 in the index, we can go to keloid and we'll see scar L91.0. So the next thing that we need to do is code the fact that this patient had a burn of their left wrist and they now have a sequela of that burn. In the index, if we go to burn and then wrist, we'll see left. We don't know what degree this was. We are going to choose this default code of T23.072. And then when we click on this red code, we are able to scroll down and choose the S for sequela. So don't forget when you're clicking on these codes to use the slide bars. So this is a sequela of that particular burn. And then we have an external cause code that we can also apply. So for this external cause, I want to show you that in the index, I can type in sequela of accident NEC, and then it gives me a range of codes. Well, I don't really want to have to go through all that range of codes. So I'm actually going to go and look for the type of accident. And I'm going to put in fire because we know that this was a fire. She was burned by a fire. So if I go to fire, it says accidental C exposure fire. So then I can go to exposure fire. We don't really know anything about it other than it was a fire. And I can see that it sends me to category X08.8. exposure to fire and flames. And when I look at this, I know that I'm dealing with a sequela. And so I will use the X's as placeholders for the 5th and 6th characters, and then apply S for sequela for that particular burn. Your question for this lecture is exercise 24-6, number 1. So go to page 611, choose exercise 24-6, and answer question number 1. And that will conclude this first lecture for chapter 24.